If you're interested in how to maximize the potential of your sexual health, then you're going to want to listen to this episode. I have Dr. Amy Killen on to discuss sexual health and how to improve your sexual pleasure. And if you're enjoying this content, don't forget to hit the like button below and subscribe to the channel. Enjoy. Welcome back to another episode of the Live Life Longer show, where we discuss longevity, anti-aging practices, biohacking, having more energy, and living a happier, healthier life. Today's guest is an anti-aging and regenerative physician specializing in sexual optimization, aesthetics, and longevity medicine. Board certified in emergency medicine with 10 years of ER experience, Dr. Amy Killen saw the impact of unchecked chronic disease and disability from the front lines before transitioning to anti-aging and regenerative medicine. An international speaker, clinical practice owner, medical director of a national regenerative medicine physician training course, author, and frequent media guest, Dr. Killen has become an outspoken advocate for empowering patients to look and feel their best by merging lifestyle modification, hormone optimization, personalized medicine, and regenerative therapies. Dr. Amy Killen, thank you so much for joining me today.
Thank you for having me.
Yeah, I'm really looking forward to our conversation and your area of expertise. You know, I find that it's very interesting being in, especially Western culture, where we have if you look at like pop culture, it's very sexual. And at the same time, a lot of people have a hard time talking about that publicly or just with other people in their lives. So I find this conversation that we're going to be having today a very interesting talk because I have a feeling that people that are listening, they enjoy sex. It's a part of their lives, and they might not necessarily feel comfortable talking about it with other people. So hopefully this will be a platform for them to kind of listen in and hear from an expert in that area. So with that being said, I want to start off just hearing a little bit more about how and why you decided to specialize in this area of expertise.
Yeah, it's kind of an interesting story. So I'm a medical doctor, and I actually was an emergency physician for about 10 years first. So my initial training was in emergency medicine.
Mm-hmm.
I went and worked in the ER for about 10 years. Towards the end of that, I had my 3 kids within about a 2-year time period, and was still working in the ER, became, kind of just super stressed out from the lack of sleep and the poor diet and the, all the chronic stress and the lack of sleep, just all the things that go together.
Yeah.
And I started seeing that I was unhealthy, and also that a lot of my patients that were coming to the emergency department had these chronic medical problems, and they'd come in and I would just kind of patch them up, send them home. They'd come back in, patch them up, send them home. And after doing this 1,000 times, I realized that, in order to help these kinds of people as well as to help myself, I needed to learn about other types of medicine that are sort of more preventative and integrative and help, them and me be able to take care of ourselves better. So I went down the road of learning and getting certified and such in like integrative medicine, anti-aging medicine, started to practice doing bioidentical hormones first. And I'd have these patients that were coming in, just like at their wits' end, like they're gaining weight and they have no energy and they're depressed and they feel miserable. And we would start them on some lifestyle changes in hormones and diet and fitness and all that. And then they'd come back a few months later and they would invariably ask me for help. They would say, I'm feeling better, but now I want you to help me with either my skin or my sex life. Yep. And so it's always one of those two things. And so now that's kind of what I do is I tell people I kind of do skin and sex. I use an integrative approach, essentially combining traditional medical therapies with regenerative therapies like stem cell therapies and lasers and all these different things to try to really focus on the health of that person and make it kind of next level health.
Yeah, I find that really interesting. And I'm sure we'll get into this a little bit more throughout our conversation, that idea that every area of health is really integrated and interconnected. And you certainly have that from your background, some of that traditional medicine side, the integrative medicine side, and kind of bringing it full circle, like looking at your patients and looking at their overall well-being of their health with better sleep, better nutrition, better relationships, and then also for what you specialize in with skincare and better sex life. So I'm sure we'll get into that a little bit more throughout the conversation, but I do find it really fascinating. The more conversations I have with people on my podcast especially is seeing how much everything is interconnected.
Yeah, I think with sex, it's so interesting. I'll have patients come to me and they'll say, I'm having, erectile dysfunction, or I'm having some kind of sexual dysfunction. And it's very rarely a problem just within like the genitalia. It's
Yep.
almost always a lot of other things that are happening, whether that's emotional, sort of
Mhm.
mental, or that's, even spiritual, or it's some other just systemic problem that's going on, hormonal problems, cardiovascular disease. Like there's so many things that really come together to
Mhm.
make sexual health work. You really
Yeah.
have to have all aspects of health. You have to have all sort of 6 components of health, as they say, that are coming together
Yep.
properly to have a healthy sex life. And so that's why I'm so fascinated by it. It's not really just about like, focusing on like the genitals. It really is
Right.
focusing on like the entire system, the patient, and all the things that the patient has around him or her.
Yeah, 100%. So let's go there with those 6 different kind of components of health. Like what and why is having good like sexual wellness, what is that really doing for our lives? What is it that we're getting from that?
Oh, doing so many things. I tell people that to me, sex is like the ultimate hack. Everyone's talking about like biohacks and what they can do, but sex is actually like we've had it forever, and it's a huge biohack. It does all kinds of things from an emotional and sort of mental standpoint. We know that people who have an active, healthy sex life, which active is usually defined as like having sex 1 to 2 times a week in a
Yep.
healthy relationship kind of thing. So those people tend to have less depression, they have less anxiety, they
Mm.
sleep better, they have better self-esteem, they feel less lonely. We know that people who have sort of an active, healthy sex life tend to have closer relationships with their partner or partners,
Mhm.
and that those relationships tend to be longer lasting and happier. And then from a physical standpoint, we know that those people tend to have less cognitive declines. They have better memory. Older people who are having more frequent sex actually have less problems with cognitive failures and declines, which I think
Sure.
is fascinating. There's some hippocampus studies on that are really interesting. We know that sex helps with blood pressure. It helps with reducing cardiovascular disease, heart disease.
Yep.
It potentially keeps your telomeres longer, depending on what research you read. Helps with sleep. I mean, there's basically everything, almost all aspects of health that you can think of. If you
Sure.
have an active, healthy sex life, sex is going to help those areas.
That's a lot that you just unpacked there. Where do we
I just
begin?
spewed a lot of
Yes.
information.
Let's start with some of the mental health aspect. You mentioned how like somebody that is sexually active with their partner once or twice a week, that it has all the host of different mental health benefits. What is it from like a neuroscientific level that you're seeing there? Like, what is it that allows somebody to have less stress or have better mental clarity? What are some things you're seeing there from like neuroscience?
You get a lot of different shifts in hormones. You get, like for instance, oxytocin is a big one that
Mm-hmm.
you get a big bump in oxytocin, not even from just sex, even just like holding and cuddling and things like that, which is of
Sure.
course is going to make you feel closer to your partner. There's going to be boosts in serotonin, which is going to be kind of, happiness. Dopamine will also, go up and back down again, which is something else that gives you pleasure.
Yep.
We also can see increases in different hormones like testosterone and things like that, which are going to, potentially go on to make you just feel better in general. So
Yeah.
it depends on kind of each moment. There are lots of hormonal changes and things that are happening. And a lot of people will ask me, what if I don't have a partner? Like, just having sex, just masturbating, et cetera. Does that help at all? And it does. Not all the studies have studied that. A lot of them have studied sort of partnered sex,
Mm-hmm.
but even just the act of sort of the self pleasure, the orgasm, like all of that has benefits as well. So I think it's important to think about sexual health, whether you have someone that you're currently, engaging with or not.
Yeah. That's fascinating. You also mentioned a lot of benefits with physicality, and what's interesting for me is we mentioned this in the beginning of the conversation, the interconnectedness of all the health elements. But having and focusing on sexual wellness, it leads to those different components that you just mentioned. Does it also do the same in reverse? So like if you focus on your physical exercise, is that going to improve your sexual wellness?
Absolutely. So that's exactly what happens. So basically, sex, positively benefits all these different areas of your health.
Yep.
And all those different areas of health can either positively or negatively benefit your sex life. So,
Yeah.
so we know that people who have depression they're less likely to have sex. They're more likely to have a low sex drive. They're more likely
Yep.
to have erectile dysfunction or sexual dysfunction. So yeah, they basically go back and forth.
Yeah.
Certainly, there's huge tie-ins between physical activity, exercise, things like that, and good sexual function, especially in men, but also in
Yep.
women. So it is absolutely important to take care of all of those other aspects of health, whether it's physical or mental or social or environmental, spiritual. All of those things will play into how you experience sex.
Sure. You mentioned also the idea of it possibly improving our telomeres. Can you tell us a little bit more about that? I know you said based on some research.
Yeah, there's been a couple of studies. I know of at least one that was, I believe it was in women actually, which is most of them are in men, but that looked at sexually active women and found that they had older women who had longer telomeres in general than
Mm-hmm.
the ones who are less sexually active. That it doesn't prove causality. It doesn't say for sure that sex is the reason that they have long telomeres. It may be an association more than anything, but I think it's interesting to think about. Does this do something on a sort of a gene level that changes expression of proteins that could have longer lasting effects than just a few minutes or a few hours?
Sure. And can you tell, just for our audience that may know the term telomeres or telomeres, however you pronounce it, they may have heard of that, but not necessarily know what it is in terms of anti-aging benefits.
Yeah, so telomeres, if you think about your chromosomes, there are these two little, it's like little X-shaped, little chromosomes inside your cells where all the DNA lives. Mm-hmm. On the end of them, they have these little caps that are almost like the shoelace caps, the little plastic caps on the end of your shoelaces, and they keep those chromosomes intact. Mm-hmm. But as you get older, each time your cell divides, that little cap becomes shorter and shorter and shorter and shorter. So that cap those are your telomeres. And so what happens is as you get older, those caps become shorter, and at some point, then if they're too short, then that cell ends up dying. Mm-hmm. And so as we get older, the telomeres shorten, and what we're trying to do is to keep your telomeres from shortening as quickly, yep. Or even eventually potentially to lengthen our telomeres through different practices. And most of that's lifestyle things that we already know about, but it's a fascinating field, and it's one of the causes of aging that are being studied as could be something we could reverse.
Yeah. Super interesting stuff. So from what I'm hearing, it sounds like if you have more sex, you could possibly extend your life, which I mean,
there actually have been there were some mortality studies in men. Again, it wasn't a prospective study, so it wasn't like they took men and they said you have to have sex this much, and then they studied them over years. But they took men and they just followed them over, I think it was a 10-year period, and the men who had active, healthy sex lives at the end of that 10-year period ended up having about a 50% mortality rate compared to the men who did not have healthy sex lives. And there's, there's several other parts of that aren't being discussed, but that's pretty big.
It's a big number. Yeah, that's a big number. What about immune function, especially in a year like right now where we're going through a global pandemic? A lot of people are worried about their immune system. What can you tell us about immune function and how it relates to sexual wellness?
That's a great question. There was actually a study that I just read about that was in college kids, where they took college kids and they asked them, essentially, how much are you having sex? And the ones who had sex between 1 and 2 times a week, that was kind of the sweet spot, they ended up having higher salivary IgG levels. So essentially, higher levels of the components in their saliva that were able to fight viruses. So they actually had the better ability to fight viruses if they were having sex 1 to 2 times a week compared to people who were having sex a lot more or a lot less.
Interesting.
It was a small study, but I think that's fascinating that something like that could affect something as important as immunity.
Yeah, I find that really interesting that that group that was having sex 1 to 2 times a week, I thought you were going to say compared to just people that were not having sex as often, but it's interesting that it beat out just in this study people that were having sex more often than 1 to 2 times a week.
Yeah, and I wouldn't read too much into that because it's college kids. Like what they could have like 12 partners, or that like very who knows.
There's a lot of there's a lot of variables there for sure.
There's a lot of variables, but I did note that as well.
Yep. What about? I think you mentioned lower blood pressure and the health of our cardiovascular system. What are you seeing there with the correlation between cardiovascular health and sexual wellness?
Yeah, I'm not exactly sure the mechanism behind why sex probably, seems to improve blood pressure. It's probably related to nitric oxide.
Uh-huh.
Nitric oxide, is the main chemical messenger that tells our blood vessels to vasodilate, which means, open up and let more blood through. And we know nitric oxide is really, it's important for everything. It's important for keeping your blood pressure low. It's important
Mm.
for, exercise, all these things. And it's really important for sex, because in order to have sex, you have to have nitric oxide that essentially opens the blood vessels up in the pelvis and lets the blood get in to those areas to, be able to have erections and to be able to have vaginal lubrication and things like that. So nitric oxide is super important. And I think there's definitely relationships between there are definitely relations between nitric oxide and blood pressure. People who don't have as much nitric oxide are going to have higher blood pressure, and they're also going to have more sexual dysfunction. And I'm not exactly sure the sort of causality of those things, but
Sure.
but yeah, nitric oxide is super important and for both of those.
Okay, that's interesting. So the next thing I kind of want to get into here is a little bit more biohacky stuff. So I know you've talked before about shockwave therapy and how that can treat erectile dysfunction.
Yeah.
Another thing I want to talk a little bit about in that same realm is I'm not sure if you have any information on this, but it's something that I've recently become more aware of, is with cold exposure and breathing exercises. I have recently gotten into the Wim Hof method. I'm not sure if you're familiar with Wim Hof.
Yeah, I know Wim.
So I did a session with one of his instructors a couple months back, and they were talking about how just the overall method can improve our sexual performance. And that's when I was like, that's interesting. I want to look a little bit more into this. And then I saw researching your work that you were talking about shockwave therapy and how it can improve sexual wellness. So what are you seeing there with shockwave therapy? If you have any information on cold therapy and breathing in general, how that can improve our sex lives?
So definitely I have a lot of experience with shockwave therapy. So shockwave therapy is also called low intensity extracorporeal shockwave therapy. That's the long name. In the US, the most common treatments are the Gainswave protocol, which you've probably heard of. Those are clinics, doctors who do the treatments in the clinic. And then there are some home devices that are coming out now that I haven't had a chance to use myself, but that are starting to be used as well. But basically it's using high intensity sound waves that are delivered into the penis and into the deep parts of the penis. And what we know from that is those sound waves cause a little bit of micro trauma. So just a little tiny bit of trauma, enough that your body's like, oh, we got to fix that. And so then your body sends in all these growth factors to the area. It sends in other growth factors that increase blood vessel formation. So you get better blood flow and blood vessel formation.
Yep.
We get stem cell recruitment, you get nitric oxide release. So it's essentially, it's almost like doing, stem cell injections or PRP injections, which I also do. It's a little different, but similar mechanism. You're essentially bringing in blood flow to help repair that tissue. And there's over 40 studies at this point that show that shockwave therapy can be effective for improving erectile dysfunction. I think it's at this point, it's 80+% effective, depending on kind of how severe your disease is. But it's game changing, honestly, in for men's sexual health.
And that's pretty recent, like recent discoveries, right? How recent would you say that's starting to come out?
Well, the technology's been out for decades. It
Sure.
was initially what's been used. It was used initially to break up kidney stones. Then it was turned way down and spread out a little bit for what we're doing with men. But it's been about 10 years that it's been studied for ED, and I've been using it for ED for about 3 or 4 years. So it's in the US, we've been using it for 3 or 4 years.
Okay. I'm not totally familiar with the method, the technology. Are there any side effects or concerns about using it, or does it seem like it's overall pretty safe?
It's really safe. I would say I would be a little hesitant to tell you just to go and find a machine, from China on Alibaba or something that will have those. But I would say you don't want to just go and buy a machine and do it yourself, probably, because you have to know what energy to put in there, how fast it needs to work, make sure the machine is a good machine. But if you're doing it through a physician's office, which is what I recommend, really, then it's extremely safe, because you're not causing any serious damage, and you're not really, it can be a little painful, but that's really the only thing.
Yeah.
little uncomfortable. We usually use numbing cream when we're doing these
Sure.
treatments. But otherwise it's super safe.
Yeah. Yeah. And if it is a little bit painful, I would say that's not the worst thing, because I'm always a fan of, not that you want to have like pain or stress in life, but there are studies that show that like certain amount of stress is actually a good thing. Going back to telomeres, you want to have a low level of stress. Otherwise, you're just going to go through life in too much comfort, and that can actually be worse than not having stress at all. So just a side comment there.
Yeah.
In terms of nutrition, where are we missing out on some things with proper nutrition? And, what kind of foods and supplements would you be recommending for people that need to and know that they need to kind of improve that area of their life, and how that can help eventually improve their sexual wellness?
I mean, in general terms, obviously, I always promote the healthy. I tend to promote sort of healthy, balanced diet. I mean, everyone's got their own take on what that means, but I don't sort of adhere to any of the specific keto or paleo or
Sure.
that. But I think as long as you're getting a good number of fruits and vegetables and a good protein and a balanced diet, then that's gonna be effective. I try to have my patients generally avoid sugar on special occasions only, but we know sugar and the glycosylation that happens with sugar, all over the body is a big reason for the inflammation that's going to set you up for things like atherosclerosis and plaque and heart attacks, strokes, things like that, and cardiovascular disease like that is probably the main cause of sexual problems, at least in men. So anything that causes increased cardiovascular disease risk, so like high blood pressure, diabetes, smoking, obesity, sedentary lifestyle, inflammatory diet, like all of the things that are going to put you at increased risk to have a heart attack or to have a stroke are also going to put you at increased risk to have erectile dysfunction. So you have to think about what you're putting in your body, not just how it's going to affect your heart or your brain, but how it's going to affect your penis. And actually the erectile dysfunction generally it can often be like sort of a canary in a coal mine. Like essentially a lot of guys will get ED 5 or 10 years before they start having problems with blood flow to their heart or strokes or things like that. So it can be an early warning sign of problems to come, it's a good chance to address those problems before they set. And then the other thing I like to talk about a lot is nitric oxide, and making sure that people are getting enough nitric oxide in their diet as well as in supplements. Nitric oxide is, it starts to go down really after the age of 20 or so. By the time you're 40, you have about half as much nitric oxide as you did when you were 20. And that just keeps going down year after year. And so you lose the ability to make that, because it's made, at least in one place, is made is inside your blood vessels, which, as you might imagine, as you get older, those vessels are getting kind of filled up with plaque and atherosclerosis, so you can't make as much nitric oxide. So you can actually get nitric oxide from food if you eat foods that are high in nitrates. So these are things like green leafy vegetables, arugula, things like that, as well as beets. Of course, you're going to have high in nitrates, pomegranate, dark chocolate, citrus. There's a lot of foods that are. We tend to recommend sort of the vegetarian variety of nitrate-rich foods for this, and then you can make it in your own body if you avoid using antiseptic mouthwash, which is something I always tell people, because you need the healthy bacteria in your mouth that's killed by mouthwash. You need those bacteria to be able to do the first step in taking your nitrate-rich food and breaking it down into nitric oxide. So that's one pro tip, is ditch the antiseptic mouthwash like Listerine. It's pretty bad for you if you use it all the time. And then the other thing with that is you also really want to avoid, if you can, using any kind of medications that block the acid production in your stomach. So there's tons of acid blockers out there, especially things like protonics, proton pump inhibitors are really, really bad, because they affect the stomach acid that you're making, and you actually need stomach acid in the right type to be able to, again, make nitric oxide. So there's a lot of downstream effects of affecting and destroying that stomach acid with medications.
Yeah. I had Dr. Stephen Gundry on my podcast earlier this year, and that was like the first time I found out about antacid mouthwash being an issue. And he was talking about with gut health and how it can destroy the lining of your gut. So just super interesting stuff that most people don't necessarily realize. They think like, oh, it's a good thing I'm going to use mouthwash. It's going to make my breath fresh.
Right.
And you don't realize the complications that can come from that.
Yeah. And people always ask me, well, can I still brush my teeth? And yes,
Please
brush
do.
your teeth.
Yes, please do.
And you can use, there are other sort of holistic and do-it-yourself mouthwashes that are not going to be as detrimental to those bacteria. So there are other things you can do to have fresh breath and do not require wiping out the microbiome in your mouth.
Yep, 100%. Going back to some of the things you were talking about with nutrition and how it can lead to certain diseases or conditions that will eventually or could eventually affect your sex life. I'm sure there's a mental component there too, where if you eat poorly, develop some sort of condition or disease, then that might perform your like mental ability of like, okay, now I have, this is leading to ED, and now like you're in your own head of like self-confidence and just knowing that you can perform better in bed. So
yeah, absolutely. The mental piece is huge. And it's sort of this feedback loop, right? You've got someone who maybe they start to have a little bit of erectile dysfunction, maybe it's mild, or maybe they have a lot of stress going on and they just can't deal with it. Whatever's happening, they're not exactly where they want to be. And of course, then they get into their head and then that makes it worse. And, and it's like this crazy loop. So if we can break that at any point, whether it's at the mental part or at the sort of physical part, then we can help to improve that. But you're absolutely right. I think the mental part is huge, especially in younger men.
Sure.
Generally the older guys, it's almost always, when they have ED, it's mostly physical. I mean, there is a mental piece, but the physical part becomes more of what's actually going on. But with younger guys, the mental part is oftentimes the main issue. And, whether it's a sort of porn addiction kind of thing, or whether it's just, they've watched too many, how to have sex and they're feeling stressed out or whatever it is, that piece of it's pretty big.
Yeah. What is it with porn addiction that is holding men back or women from living a little bit more freely and having a better sex life? Like, what is it that you're seeing in the research from, that addiction standpoint that is maybe holding somebody back?
Yeah. There's a lot of arguments on whether there is an actual addiction with porn. So I don't, whether we use that word or not, it doesn't really change the fact that there are a lot of people, and it is mostly men that I see in my practice that they're consuming porn so much that they get to where they're almost sort of numb from it. And you get this dopamine surge, but it takes more and more and more to get that same dopamine surge. So it's not just regular porn now; it's some other kind of porn with other. It basically you have to escalate. And what ends up happening is that then when you have a real life partner in front of you, that's no big deal, and you can't be you're not as excited because you're used to seeing all these other crazy things, all the time. So that's something that is, I'm not anti-porn at all, but I do think that if you're using it frequently and you're having to kind of escalate the type of porn that you're watching, that can be damaging to an actual relationship. And it can get in your way.
Well, it most likely sets pretty unreal expectations as well. What we're seeing in porn is an idea of what people think, like, oh, that's how sex should be. That's how body shape should be. And really it's unrealistic to real life.
Yeah, absolutely.
How about, we've talked a little bit about like mental state. How about like your frame of mind while you're having sex and how that it can improve your performance? What can we be doing to maybe remove distractions, have a little bit more focus and clarity while we're having sex? What are your thoughts on that?
Yeah, I mean, definitely extremely important. Just being present and turning off the sympathetic, kind of getting into that parasympathetic state is really important. And it's hard because a lot of us have this chronic, like little, stress talk going on in our head. And so, everything that we can do, whether it's breath work, like you mentioned, breath work or journaling or meditation or long walks or exercise or, just spending some quiet time in a bath, everyone's got sort of a different way of handling it. But I will say that stress and sort of uncontrolled stress that the people is not being handled is one of the major causes of sexual dysfunction that I see in people who are otherwise pretty healthy is that they, stress itself is going to mess up your testosterone levels, and it's going to affect your hormones, and it's going to, affect all kinds of things. But more than that, it's very difficult from a physiologic standpoint for you to have sex if you are under a lot of stress. Like you actually need the parasympathetic, the sort of rest and relax system to be the one that's primarily working to get the blood into the pelvis, to get the erection to stay, to get like all the actual structural stuff requires you to be in a certain state. And it's not a super stressed out state.
Right. Exactly. No, it's super important stuff that, in a way, a lot of it's on a subconscious level that people may not even realize they have certain stress or certain thoughts that are in their head that's really holding them back until maybe somebody brings it to your attention, like your partner, or maybe it becomes more conscious and you can realize like, oh yeah, this is affecting my ability here.
Yeah. And of course there's a lot of, and I don't deal specifically with this because it's not my field, but there's a lot of, past trauma, sexual trauma, things, spiritual kind of trauma, things like that are obviously going to significantly affect your ability to have and enjoy sex. And, and certainly talking to a sex therapist or someone who is familiar with how to treat that is really important. I think that's something that it's not talked about as much as it should be, but it's actually more common than a lot of us, wish it was.
Yeah, 100%. I guess sort of on that note in terms of seeing a therapist, because I feel like that's an area where there's a lot of stigma, especially just like I imagine you were alluding to a sex therapist, sexual therapist.
Yeah.
But regular therapy, I think oftentimes has some stigma. People might look at that and think you have something wrong with you or you're weak. But I think we're making good strides in really the last decade with that area where it's like, no, you're not weak. Like it's just healthy to talk to somebody. And the same thing with sex therapists. So I guess on that note, what are some myths that you're seeing in just the overall field about sex? Maybe it's, and really we started the conversation off. I was mentioning how I was interested to have this conversation and kind of break down some of those barriers, break down some of that stigma in the field of sex. What are you seeing there with the main myths?
There are a few myths. One of the myths I see is that you are kind of supposed to lose interest and ability in having sex as you get older. That that your sex life the quality is supposed to go down as you get older, and I think that is not true. It may change the way the actual physical physicality of it may change a little bit, but sure. I think especially now that we have so many sort of regenerative therapies that we can combine with things like hormone therapy and other things like that there's no reason that you can't, if you want to, that you can't have a healthy sex life as you get older, and if obviously if that's not something you want, then that's totally fine. But if it is something you want, we have ways that we can help most people at this point.
I think that's a big one. I think especially for young people, they automatically think that older people don't have sex, and maybe it's something with like you don't want to think about how your parents may still have sex or something along those lines. But as you get older, for me, thinking to myself like, yeah, of course I want to be having sex until I'm well into my 70s, 80s, however long I live. So I'm happy to hear you say that being one of the myths.
Yeah, I was doing an interview for a magazine in London a year or so ago when I was there, and the interviewer was this very sweet lady, this very sort of London, this very English lady, and I'm talking to her about men's sort of sexuality as they get older, and she looked at me at one point and she's like, I don't understand. Why would people want to keep having sex after they're 50 years old or whatever? And she said it with this like, cute little English accent. And I was like, I don't know. I mean, some people do want to.
Right. Yeah. That's interesting. I wonder if she was thinking of more of a biological standpoint of having children and having offspring.
I think that she was thinking of it as more of like she was relieved that she maybe didn't have to think about it or worry about it as much. And it's a real thing. I think with both sexes, but especially with women, oftentimes we'll lose interest in sex and like just kind of, a lot of my patients, probably most of my women, if I ask them, how is your libido or how is your sex drive? Yep. They almost always say, either what sex drive or, it's pretty low. Very rarely, and I see patients that are generally in the 35 to 65 year range. So they're a little bit older, but very rarely are they like, it's awesome. So
Right.
it's, it's very common to have less interest in having sex and for it to not be at the top of your priority list because, you've got other things you're doing and you've got jobs and kids and, all these other things.
Yeah.
So I think, but there is pressure, I think, from some people that you're supposed to be having sex, you're supposed to be interested. And then they're like, well, I'm not really. And so, maybe just the interviewer may have just been thinking like, well, now I'm at a certain age and I don't have to even worry about it.
Right.
But some people do want to worry about it.
For sure. Is it also too with like as we age, we're seeing a depletion of hormones that would reduce that need and that desire to have sex?
Yeah, absolutely. For women, certainly once you go through menopause, which, is 45 or 50, you lose estrogen, testosterone, progesterone, sex drive goes way down when you lose those hormones. And then you have changes in the tissues itself that, vaginal changes and things that make sex not as enjoyable.
Sure.
And of course, for men, it's testosterone that as that starts to go down, they start to have more problems with erectile dysfunction and more problems with lack of libido. But, we can easily replace those hormones now. And I'm a big advocate for using bioidentical hormones to replace those hormones in patients who are appropriate. There are some that are not, but for the most part, we can keep those hormones up and keep you feeling good and keep you interested. And it's not just about sex, it's about everything else, cardiovascular disease and keeping you fit and keeping you active. And, there's a lot of things to it, but sex is one thing that we can kind of keep on track if we keep those hormones balanced.
Got it. Very interesting. I know you do a lot of work with stem cells. So how can stem cells improve our sexual function?
So I do a procedure where I essentially inject stem cells from the patient in combination with things like exosomes, which are going to come from like placental tissue, they're growth factors. I'll inject those into the genitalia. So essentially doing, injecting directly into the penis, into the clitoris, into the vaginal wall. And the idea behind that is that the stem cells and the exosomes are going to essentially communicate with the cells that you already have in those areas. So, as you get older, your cells can become a little bit less responsive, less active. And so we want to try to get the cells that are already living there to become more active, to produce collagen or elastin or increase blood flow or whatever, depending on what we're injecting. So the idea behind stem cells is actually to kind of regenerate or repair some of the tissues that maybe have had some problems due to time or illness or whatever.
Okay. And the clientele for that, is it based on like for age? Are you seeing it being from older people or is it just people that are generally having some issues with sexual wellness?
It's, it's about 50-50 people who are having problems and people who are not having problems. So I treat a lot of the biohacker kind of crowd because, I treated Dave Asprey and Ben Greenfield and Mark Hyman and Mission and a lot of these guys who are very health conscious. We've done stem cell procedures on them and for not just for the sexual stuff, oftentimes for other things. But so we're treating people who are oftentimes pretty healthy. They're just trying to extend the health of different parts of their area, their bodies. And then I have another group of patients who do have sexual problems, men and women. So erectile dysfunction or female sexual dysfunction, of different sorts that are trying to actually repair something. So it's kind of about half and half.
Interesting. I also realized I kind of jumped right back away from the myths. I want to talk a little bit about that a little further because I feel like for most people, they have some sex education, usually like in high school, at least in like the Western world.
Right.
And of course, we can always, research on our own and Google things. But for most people, they don't spend a lot of time educating themselves on the real core things that are going on in sex. So what other myths besides, the one that you mentioned with a lot of people don't have sex as they age, what else besides that myth do you see often?
Another myth I see a lot is that we don't really have a lot of therapies available for females with sexual dysfunction.
Okay.
You know, we know that with men, we've always had, not always, but for a while we've had Viagra and Cialis and those kinds of things. So,
Yep.
so men have become a little bit more used to going to their doctors and say, I'm having this problem. Can you help me? Because they know that there's something out there that they can do for them. But with women, because I don't think a lot of women know that we actually do now have therapies that can be really effective for helping with sexual problems, whether that's lack of interest or arousal problems, orgasm problems, pain problems. But it's not being talked about as much, I think, in women because of that belief that, well, why would I talk to my doctor? Because they can't do anything about it. But you know, between things like stem cell therapies and vaginal lasers and radiofrequency therapies and hormone treatments and different types of supplements and different wearables, we actually have a lot of options for both sexes, which is one of the myths I think that I see a lot.
Yeah. I'm happy you are talking about that because I feel like it's kind of always been about men when it comes to sexual wellness.
It has been.
and I think it's about time to make sure that we're, you know, incorporating women in the conversation as well. So
yeah, women have definitely, you know, they've kind of gotten the short end of the stick for a while, right? Like no one's ever talked about like how much they're enjoying it or how pleasurable it is for them. It's like, you know, unless it's really hurting them for a while, people just kind of ignore that. And I think now in recent years, people have become a little bit more vocal about, hey, we get to deserve, you know, we deserve to enjoy this as well. And so, you know, just keeping that equality there, I think is really important.
Definitely. And if you look at, it seems like there's always been a focus on, for men, you know, how can men improve their sexual performance? I was watching or listening to a podcast recording that you did recently, and you were talking about how it shouldn't even be called performance, but we have that expectation for men to perform. But I think it's important on that note too, to look at what we can be doing to help women, you know, improve that area as well.
Yeah, no, you're totally right on. Whenever someone says performance, and I say it too, I just won't forget about it. But the idea that men have to perform, you know, it's like they're in front of an audience and all the spotlights are on them, and they probably feel that way sometimes. But it really shouldn't be about performing. It really should be, you know, about a connection that you're making with somebody else, and you know, something that brings you both joy. But so I totally agree with you.
Yeah, no, I appreciate that. I'm kind of going back over now to nutrition and things of that nature. What about alcohol, and how does that play a role in people's sex lives? I know, you know, I'm sure a lot of people, kind of a natural progression. They might go out for drinks or have drinks at home now in quarantine. And then that sometimes leads to the bedroom. What are you seeing there that you're maybe concerned about when it comes to consuming alcohol and how it correlates with our sexual wellness?
So, you know, a little alcohol can be kind of lubricating and, you know, lubricates your mind a little bit and makes you, it lowers your inhibitions and such. And it can be helpful for getting sex going. But certainly too much alcohol, there's a point where you hit too much alcohol and you actually can have problems with erectile dysfunction, you know, problems with just you know, orgasming. You hit a point where, because alcohol is a depressant, you know, that's what it actually does. It's going to make you tired and it kind of turns things down in your body. There's a point where it's not super helpful. So I would caution against drinking too much, and certainly chronic alcohol abuse is going to be damaging for your body in, you know, any number of ways that will eventually affect your ability to have sex.
Yeah. You mentioned obviously alcohol is a depressant. Do you have any information on like that connection between two people, especially maybe for the first time, if alcohol is involved? Does that kind of depress the chemicals that are going on between the two people in terms of that connection?
I don't know. I haven't seen. That's a good question. Like the pheromones and kind of the way that people interact with each other. That's a great question. I'm not sure about that. I know that like birth control pills affect what pheromones you're giving off, and the person that you're attracted to is your birth control pills, and being on those actually can change who you're attracted to. And so that when you get off the birth control pill, sometimes you're not attracted to that person anymore, which is kind of fascinating.
Yeah, I've heard this, exactly what you said. I've heard that before. What are, like, I guess in a way that's a good thing, because if you do come off the birth control pills, then maybe you realize like I'm not with the right person. What do you think we should be doing there? Like, no, not necessarily looking for your opinion on whether women should take birth control or not, but what are your thoughts on that in terms of safe practices, healthy lifestyle to make sure that you are with the right person, with your sexual partner?
Yeah, that's a good question. I think that there's probably a lot of answers to that. I wouldn't say you have to stop your birth control for sure. That is something that has been studied, but I don't know how important it is as far as choosing your partner.
Mm-hmm.
I think more than anything, it's about finding someone that makes you feel good. It also makes you grow and is going to be accepting of you growing, over the years and changing. A lot of times what happens in relationships, and I'm not a relationship expert, but a lot of times what happens is, you kind of grow out of each other because we're all changing and evolving. But if you have a partner that really wants you to kind of stay in the box that you were in when they met you and doesn't want you to change and evolve, then I think that's one of the biggest things I see in my patients who have, separated from partners is they're like, well, we just outgrew each other. But a lot of that's lack of acceptance, because, we're all changing, hopefully. And if you're not, then that's another problem.
Exactly. And I think a lot of that comes down to what you were saying before is like, if you work on your sexual activity with your partner together, that will improve your connection, it'll improve your relationship. And I think a big piece there too is communication, is making sure that you're on the same page at all times, good or bad, but you're staying in good communication so that there's clear expectations on all fronts, but specifically with sexual wellness, what your partner's looking for, they know what you're looking for. And I think that just kind of grows that bond in that relationship and in that connection.
Yeah, absolutely. I have patients who like, they'll be, people who've been married for 10 or 20 years, and I'll see one of them in the office, and they'll be coming in with some kind of sexual problem or dysfunction. Mm-hmm. And I'll say, well, what does your partner say about this? Or what have you guys discussed about that? And they'll say, oh, I haven't talked to my partner about it. And, it's both men and women, and they're, for whatever reason, they're oftentimes not having that discussion. And I think that's contributing to the actual, whatever the problem is. Obviously there's other things going on, but I think it's still really difficult. It's easy for us to talk about sex as in like, sex is cool and it's happening, it's everywhere. It is everywhere sort of in the world. We see it, but I think it's very difficult for us to talk about sex as in, I'm having sex, but it's not as perfect as I want it to be. I'm having problems. People are still resistant to talking about sex, almost like with mental health. Like, it's almost like if you admit that you're having some kind of problems, that you're not interested, that it's, that it's not fun, whatever it is, then you have it's your problem. You're less than other people. And that of course is not true, because, a good 40% of people over the age of 40 have some kind of sexual dysfunction. And that's, depends on how you categorize that, but that's a lot of people who are having concerns that are oftentimes not being addressed.
Yep. 100%. Before I get to my last few questions here, what else would you like to talk about, maybe that we haven't covered in terms of sexual health and wellness?
I think that one of the main things that I talk to people about is thinking about it from this sort of integrative approach. So it's, there's things you can do. So things you can do are things like, making sure your diet is dialed in, making sure you're getting enough, things like vitamin D, which is important for supplements, making sure you're getting enough nitric oxide, protein, all the things you need to do to be able to make your hormones, to keep your body healthy, and to prevent other diseases that are going to eventually cause sexual problems from happening. And then there are things that you can do at home. So things like, for women, for instance, there are several different home vaginal devices, like a red light therapy intravaginal device called VFit you can do at home, or intensity device, which is a TENS unit for your vaginal floor that you can do at home. There's all these like gamified Kegels apps you can do at home. So there's a lot of things you can do at home. For men, I recommend any man who's not having pretty consistent nocturnal erections, I recommend that they think about do penis pumping at home, because that is really important. So there's things you can do at home. And then there are, of course, things that we can do in our office, different doctors, but energy devices, lasers, radio frequency, shockwave therapy, things like that, stem cell injections, PRP. mortality.
Yep.
So there's several levels of how we can help. And part of it obviously involves the patient being very proactive at home.
Right.
And then there's, we can kind of escalate that from there. But it doesn't matter who you are, there's always something that you can probably be doing.
Yeah. No, that's super helpful because everybody has their own situation, their own sex lives, their own needs. And for one person, they might be able to work on something at home. For another person, they may need to see a medical professional like yourself. So that's super helpful for my audience because it's a wide spectrum of people that have different needs and different desires. So that's super helpful. I also understand you do a lot of work with skincare. So tell us a little bit more about that work with skincare and what you're doing there.
So it turns out that a lot of the same therapies that I use for sexual health and a lot of the same kind of prevention that I use to keep the sexual organs healthy are the same exact things that we can use for skin. So everything from stem cells and PRP injections to lasers and radio frequency devices to optimizing hormones. It's really, estrogen, for instance, for women is really important for skin health, and something that happens after menopause is you lose your ability to make estrogen. All of a sudden, that's why all of a sudden, in the year or two after menopause, skin becomes very thin and crepey, and like you age. A lot of women are, come to me and say, I've aged 5 years or 10 years just in the last few months, and that's a loss of estrogen. And again, we can fix that with topical creams, with systemic hormones. We can help with those kinds of things. But there's lots of different. There's so many overlaps between skin health and sexual health that they're obviously different systems, but I treat them very similarly as far as prevention. The same types of diets are going to help your skin. Low sugar diet, for instance, is going to be great for skin, great for sex. So I have a lot of patients that will come in and we'll kind of do both. We'll treat both areas because it's pretty easy because I say, this is lifestyle changes, and then I'll be using the same kind of therapies for both, and they end up working for both areas.
Yeah, no, that's super helpful. And going back to the piece of kind of anti-aging, I'm sure a lot of people, they want to make sure they still have fresh, clear, clean, good-looking skin as they get older. What about something like Botox? What are your thoughts on that?
I think Botox is fine. Or, a lot of people, it's really helpful. It's something that is not accomplished by most of the other therapies that are out there. So, Botox is going to essentially be injected to stop the muscles from moving in a specific area that prevent dynamic wrinkles, which are the wrinkles that are created when you move your facial muscles. And obviously you don't want to get too much or you don't have any movement, and then people think you look like a statue. But for things like forehead wrinkles or wrinkles like in here or like around the eyes, Botox is very effective. And, we've been using it now for many years, and the incidences of actual harm that have come to patients is extremely low, and mostly in cases where it's been used for non-cosmetic things like muscle spasticity and things like that. So it's actually really safe as far as things that are out there that we can do.
It's good. It's good to know. And maybe I'm wrong. Maybe I'm just being a typical guy and I don't know much about Botox, but I do think there might be a little bit of stigma there that it's like there's that element of unknown. Again, maybe more so in men that just don't practice it and don't use it, that they might think like, oh, it's, there's something that's unhealthy there for our skin, or could have some sort of harmful effects as you get older, but obviously that's just not the case.
Yeah. And, I would say to men, I was using Botox for myself probably for several years before my husband had any idea, because he just didn't pay attention. And I have a lot of patients, both men and women actually, who do Botox and they don't tell their partners, and their partners have no idea. So if it's done properly, you're not going to have people, really asking you about it.
Yeah. And that makes sense too, I guess, for somebody that you live with or you see on a daily basis or quite frequently. They may not notice because they're seeing you so much that to see that change is they're not going to see that over time.
Yeah. And it's a subtle thing if it's done properly again.
Yep. Exactly. Very cool. Before I get to my last question here, where can people find you and learn more about your work?
So I'm really active on Instagram. Dr. Amy B. Killen is my Instagram account. I do a lot of educational posts and things, as well as just random other posts, but I'm pretty active on there. Also, Dr. Amy, my website is dramykillen.com is my website. I have several others as well, but that's sort of the central landing part for that. Those are kind of the two main areas. I do Facebook, but not as much, but I do like to do educational stuff around, especially around longevity, skin, and sex on Instagram.
That's great. I'll be sure to have all of that linked up too and in the show notes for people to find pretty easily. Excellent. So my last question for you that I have here is, who do you want to impact the most with the work that you do?
Who do I want to impact? Honestly, I want to impact anyone who is especially I'm targeting people who are over the age of 40 or so, who are worried about aging and worried about kind of becoming irrelevant and worried about lack of confidence and sort of worried about that sort of downward trajectory that they feel like their health may take. I want to empower those people to sort of take back their health and to really keep healthy and keep that health span going as long as possible, not just sexual, but just in general. I love the idea of promoting longevity in a way that's really about optimal health for as long as possible.
Yes, I love that. I love that line you said, helping people take back their health, and the clientele that you have and the people you're working with and working for. I think you're doing exactly that, especially when it comes to sexual health. People that maybe have lost hope or feel like that, that there's no way to improve some of the issues that they're facing. That's exactly what you're providing, is that education and kind of instilling that confidence in them. So I appreciate all your work.
Well, thank you. Thanks for having me on today.
Yeah, this has been so great. Thank you so much.